All right, welcome to part two of emotional process for health and illnesses. And last week, in part one, we spoke about the general attitudes we have about health and illnesses. And I shared my perspective on what is it that I'm trying to investigate from my own work, for personal and for work. And just in case I haven't introduced yet, I'm a naturopathic doctor here in Vancouver. And what I'm trying to understand is that there's a principle in which if I'm ill, the truth principles and the law of compensation, the law of cause and effect, and the law of attraction work together to expose that I'm attempting to emotionally deny a truth about love, which is a love of self, of the other half, the soulmate, or others, or the environment. So that is what we're working through, what I wish to investigate, and I'm sharing what I've learned so far from it. And so the idea is that we're denying something, we're denying a truth, which is usually an emotional truth. And when we have an illness or an accident or an injury, or our children or our pets have illnesses, accident, injuries, then there are a couple of assumptions that we can make. One is that you have absolutely no clue what it's about. You can guess, you can even think you really know what it is, but if you are having physical symptom or law of attraction, you have no clue what it's about. It's completely, I've done this for hundreds of patients, for myself, you are clueless with what the issue is about, especially when it's in your own children. If you have completely detached from the issue, it will show up in your children. Otherwise, it will not show up in your children. So assumption one, you have no clue what it is. Assumption two, when you do find out what it is, you're going to hate it. You're going to hate it. You're going to want to say, oh, I didn't know it was this one. It can go back. You can go back to my kid. You can go back to being in denial. I hate it. That's always a reason why you want to stay in denial. You absolutely don't want to have anything to do with it. And all of us are deciding that we'd rather die than feel the emotion. That is what we're doing. And three, the way I usually discover the connection is by going along with what I'm already doing. I verbally will agree with what I'm already doing, let it come up emotionally, and then the issue will emerge. Knowing that when it emerges, I'm going to be surprised and I'm going to be very upset about what has come up. So for today, I decided to pick an issue that I've had for a good 2 decades. I have pain. I have all kind of interesting pain in my neck. Casey knows, all the RMTs knows how interesting my neck can get. And I decided to just pick one part, which is the SCM muscle, the sternocleidomastoid muscle. Usually it's like a cord and it sticks out. You can actually pick at it. It's like a guitar pick, like it's tight. So I decided to work on that one. And the way you do it is you let yourself feel the physical pain itself. You let yourself feel the sensation. You let yourself feel the tightness. And so then I started to walk up and down. I find pacing really helps me. I'll walk up and down my clinic, and I started to say, I don't want to know what this neck pain is about. I really, really don't want to know what this is about. I do not care to know what truth I'm denying here. I don't want to know what this is about. I'd rather be in pain. I'd rather be in misery. Well, I've been doing it for 20 plus years. I'd rather take this to my dad than know what the truth is. Because that is me agreeing with what I'm already doing. You just have to go into it. If you have an illness that's probably like going to end your life sooner than you would like, you can actually say, I'd rather die than know what this is about. That's how much I really don't want this emotion. I don't want to know the truth. I don't want to feel this emotion. Do not tell me what it is. So when I was dealing with this, I was actually in a tantrum. Don't you dare tell me what this is about. Don't you dare tell me what this issue is about. I don't want to know what this is about. So I was really going into the emotion, really going into the rant. And within 5 minutes, I started to say, I do not want to know how broken I am. And I went, well, what did I just say there? Oh, what just happened here? I started to feel a sensation in my chest. At first, I was feeling the sensation in my neck. And at some point, I started to feel there's something happening in my chest area. And then I said, I do not want to know how broken I am. I do not want to know how damaged I am. And I go, found it. That was it. So then I went into that emotion. I don't want to know how broken I am. I don't want to know how, and I could feel I'm just fragile and shattered and broken. I could start to feel it, but I continued with the resistance. Obviously, there's a reason why I don't want to know how broken I am. I don't want to know what it feels like, which is what I've been doing for, well, 4 decades. So I kept saying stuff like, I don't want to know how broken I am. And then the memories started to come back. And I started to go, oh, this is from that period of time. And in the meantime, the pain disappeared. This pain in my neck, gone. I even start to like poke at it and pull at it. And it's like, there is no pain. Within 10 minutes, the pain disappeared. And I'm thinking, well, but the tightness, that's probably going to take a while, some months, some years, because it takes time for the physical body to regenerate those tissues. For example, bones can take up to 7 years. So even though you've healed the issue, it'll take up to 7 years before the bone regrows stronger to show you that you've healed. So I was not expecting much to happen besides that. The pain is gone, I found the issue, it's good. And then now, by the time I got home, it's been probably about 4 hours now, it's soft. The cord is gone. It's already softer. And there's no pain. Usually you can't touch it, and you can pinch the SCM muscle and it's nothing there, just a soft muscle. It's already reversed. So that's pretty quick. But I am feeling a lot of despair because now I've found the emotion I was denying, which is this heavy, heavy despair. And I have memories of being 14, and I can clearly remember what I was thinking at that time, what I was feeling at that time, what was going on, my friends, like this part of me is now back. Because fortunately, as I was connecting to all this situation, and I started to write down what my blocks were, a massage therapist at my clinic had an open spot. So I went to her and I said, because I now have a visual, I can see what it looks like, what that person looked like that I'm connecting to, that hurt self. So I said to her, imagine that I'm a prisoner of war and I've just been released and I've been tortured and I'm malnourished and I can barely walk. How would you treat me? Could you give me that treatment? So I let myself be that person that's that broken and damaged. And she treated me in that way. The massage she gave me was exactly as how she would imagine that. And all my body sensation came back. By the time I was done, I was her. Her feeling had completely integrated with my current experience. It was that quick because I was allowing myself to feel I am that person. Let it come. So I have a lot of despair. I have a lot of depression. I feel insane in how terrible I feel. But I have a lot of experience now from having done all of these processes before. So I'm not afraid of feeling insane. And the despair will take time. And I'm also having physical pain now from that despair feeling because it's like the example Jesus gives is if you've been holding your arm in an unnatural state for year after year after year, and then you finally let it go, there's going to be this pain that comes in because the circulation is returning. So I'm feeling this ache from head to toe, which is like a law of compensation for being in this unusual numbness for so long. So I'm going to allow myself to experience the pain while taking care of having found this very, very broken person. And while she was giving me a treatment, I kept saying, I don't want this despair. I don't want to connect to this person. I don't want her pain. And I started to feel all my blocks. You're an inconvenience. I don't have time and energy for you. I gotta go make a living. Who's got resources to take care of you right now? You're too damaged. How on earth am I gonna repair you? It's too late. You've already been a burden enough on everybody else. What more do you need? If people find out how weak you are, no one's gonna take care of you. And I've coincidentally been addressing my addiction to being needed, and somehow it all tied in at the same time. That when I was in that much despair and I had to shut it all down, I went into the addiction of being needed as a way of finding worth and survival, and which I'm now addressing. So those are the top. This is just the past 3-4 hours. I'm happy to take some question about clarifying this process. And then I've got a couple other points to come up with, because I've tried to remember that whoever's watching this video probably have no background about what this work is like. So please don't panic. There's a process for how this works. Casey.
When you were doing your experiment today, did you encourage the pain in your neck by like pinching it or poking it when you chose the SCM, or did you just take a minute to stop and focus on the SCM to feel the pain?
My SCM is so painful, I don't need to poke it.
Okay. Okay.
Some of you may need to go find and kind of go, wake up, what's this pain? It's always, you can see it sticking out. So, and the SCM muscle is connected to the stomach meridian. And so this is where you kind of start to put it together going, the stomach meridian is about digesting and assimilating your experiences. And so, or on the negative aspect, the stomach meridian is you using your mind to distract yourself from everything. And the neck is that bridge. And all the neck muscles are that bridge. So you can kind of see how it all comes together. Yeah, so it's, but letting yourself feel that can really help for sure. Other comments, questions? Michaela?
I did a bit of a similar process last week, and I found out the cause, but then I just didn't want to go there, and so I didn't go there, and so the pain came back.
Yes.
So what do you suggest to do in that sort of situation?
Perfect. So this vision I had of this broken person, I found her 3 weeks ago in a meditation. I found myself discovering and rescuing this broken, emaciated person. And I was so freaked out by what she looked like, I shut it down. So it is a common experience. And so today what I'm doing is I'm staying with, I don't want to feel the despair. I don't want to feel her. I don't want to be anywhere near this. I don't want to remember. And yet the pain is coming back. The pain is waking up. I've already integrated the experience. All of my memories are back, like I'm there. So by continuing to stay with what I do feel, which is I don't want to do this, it's coming back. So just feeling those feelings, already releasing the resistance. Yeah. There's a reason why we have so strongly block our awareness of the emotion. And we need to kind of honor and grieve the reasons why. I don't want to be a burden. It's too much resources. I don't have time for you. I need to survive. Who's got time to sit there and be all broken? And how long are you going to take to get better? And so all of those fears are coming up. But all you have to do is feel those feelings and stay in it. And you're not trying to talk yourself out of it. You're not negotiating. You're not punishing. You tend to want to first feel like it's a punishment. Why am I being punished? Somebody else did stuff to me, and now 40 years later, here I am. So I'm the one feeling physical pain from struggling and suppressing what somebody else did to me. Wait a minute. So you'll feel like you're being punished. You feel it's not fair. I worked through those layers before, so you don't have to do them again. Couple of other blocks that came up for me was, Let me just write it down. So the SCM pain, I don't want to know how weak and fragile I am. I don't want to know how broken and damaged I really am. I need to believe I'm okay. I've got this. I need to feel I'm in control. I can fix it. I can get on top of it. I don't want to surrender to how terrible I really feel and how broken I really feel. Those were the layers I was breaking through. And then I start to work through, why don't I want to feel how broken and damaged I am? I'll be dispensed with unless I'm of use. I'll be discarded. I will not be needed, but I have a strong addiction to being needed. It'll make my mother look bad to others. She'll become angry if a facade isn't met. It will inconvenience her. And I've already done enough of that. I already burden her financially just by existing because I'm female. How will I function? How will I survive? I need to keep pushing. I can't rest yet. I'm weak, and that's dangerous to show. I don't want to acknowledge that people have been able to damage me to this extent, and I'm helpless to do something about it because somehow the helplessness is my fault. If only I was stronger and tougher, I wouldn't have been abused. I feel embarrassed by my condition. I may never recover. I may never get better. I'll always be scarred. So these are the blocks to why I don't want to feel those feelings. So now I'm going to have to let myself process those emotionally. Experience. So don't negotiate with it. Don't fight with it. Don't judge it. Experience it emotionally. And those are all fears. And then as you process them, that feeling of despair will just come on. And it'll feel very organic. It'll just feel like I just need to be here and exist and leave. Like it's not asking for anything than just to be here. I just need to be in my despair. Other questions? What do you feel when you hear me speak like this about my experience? What comes up for you guys? Kathy? Kathy S.
This is really intense feelings come up for me because there's some stuff that I can resonate with you.
Yeah.
And I find it like, is this stuff that we're repeating in ourselves that, we've worked on these layers, we've peeled back, we see the resistance, we go into the emotion, we tantrum, we do whatever we need to do.
Yeah.
And sometimes you get that feeling you're done with it, but it's not done with. So it's like a lifetime process. Like, do you know what I mean? Like, I know you've done so much work on yourself.
But I'm seeing the results. I'm seeing incredible results because I got through this in just 3 hours. Boom, 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 boom. I'm through.
Right.
That's really fast.
Okay.
That's really fast.
I guess that's what it brings up that emotion of, are we ever done with this pain and despair? You know what I mean? Like,
no, I would rather that you actually let yourself go through that.
Yeah.
Let yourself go through the feeling of, will this ever end? Will there ever be any happiness? Actually let yourself go through it because it didn't come up for me this time. I didn't need to go through those feelings. I've done them before. So then it doesn't come up again.
Okay.
Yeah. Actually honor that layer. There is a layer coming through to be released and it doesn't come back after. In the past, I would spend months going, why am I being punished? It was somebody else who did this. Why am I the one in pain? Months of having to work through that layer. And now it doesn't come up. You just go right through going, yeah, no, I got that. Like I felt I'm feeling punished. Nah, that's okay. I already know what that's about. I don't need to go through it.
Okay.
So
yeah, that makes sense. Yeah.
Yeah, absolutely.
Thanks.
Thank you. Other comments? Michaela?
It feels really hard, and it feels like I just don't know myself enough to be able to connect to all those blocks.
Okay. So, the shortcut that I used was that I kept saying, I don't want to feel how broken I am. I don't want to feel how broken I am. I don't want to feel how broken I am. And I kept pacing back and forth, and I could see at that time, it felt like her over there and me over here going, oh, you, oh, I don't know. So I just kept staying honest with what that was. And then the blocks just kept popping. Like it was like boom, 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 boom. And I'm going, oh yeah, that is how I was treated. Those are her blocks. But I could feel me in my facade treating the hurt child that way. I don't have time for you. You are completely emaciated and broken, and your bones are barely sticking together. And how long are you going to take to fix this? How am I going to find resources to take care of you? I can't do this right now. I could feel all these feelings coming up in me going, okay. But I didn't judge that. That's how I feel about the hurt child. And I didn't judge that the hurt child is going to need what she's going to need. I felt burdened by it. I feel afraid of it. But I just had to stay in what I was really feeling. That's it. So, Michaela, what do you feel you're doing at that time where it becomes hard? Are you expecting that you should?
Well, I think
Go ahead.
I go into my mind and I want to understand it. I want to work it out. Like I don't stay in the feeling.
Yes. Okay. And there was
Yeah.
a time when I needed to understand. So I used to come up with like a 20 Q&A question list about all addictions and all emotions. Like, okay, I got to grief. How am I going to do this? And so I would come up with all these questions, and then I would start channeling all my answers. And it really helped me to understand. It actually really helped me going, convince me why I got to do this. This is terrible. Why? So I'd ask all these questions. I'll get all these answers. And through the process, I will go, okay, I get it now. I get it now. So that softened that resistance piece by piece by piece. So that was a process. And I would encourage you to actually go into those dialogue. I want to understand. Help me understand. And there's something very precious that you get from going through that process. Selena.
What comes up for me is that's not going to work for me.
Oh, how come?
But I'm already starting to feel the feelings around that. So, because I started feeling these last week, so oh yeah, there you go. There's another leg of feeling excluded.
Okay.
Solitary, alone, excluded, mostly just excluded. Yeah.
Yeah, because excluded is different from solitary.
Yes. Right.
There's
yes.
something very active about being pushed out.
Yeah. Excluded. Yes. And the reasons for that. Yeah. So I felt through some of that, but I think I got to feel some more stuff around that in terms of my physical health.
And if you're having
the relationship.
If you're having physical symptoms, they probably have nothing to do with being excluded. It's probably something completely different. What I found today was something completely original and different, even though I already had a visual of that wounded child, broken child 3 weeks ago. And then I disconnected from it because I was frightened by it. But this pain I had today, I had no clue, and I don't even try to guess.
Yeah, but I think for me, it's the lack of faith in the process comes from feeling excluded, but it's not actually why I have the pain.
That's right. That's kind
of what you're saying. Yeah. But the reason why I'm in denial is because I feel excluded.
Okay.
In denial of the pain, of what's causing it.
That's right.
Yeah.
It gets interesting. It's kind of like for me to have my SCM pain disappear in 10 minutes, and now the tight muscle is already softened to the point where I can't even find it. That's a shock. For me, I'm shocked that I didn't expect it to be that quick. So the moment you're no longer in denial, it changes. Yeah. Burn. Bernice, are you there?
Yes, I am. Yes, hi. So like Selena, that I feel denial when I was listening to you speak, a denial of my experience being not as important, or, that didn't really happen, or didn't really have that bad a childhood.
Yeah.
And then I think I'm confused as well by repenting and probably it might be guilt that I really should be thinking about others and the harm that I've done to them instead of processing the harm that I feel has been bestowed on me.
Got it.
So I'm like a flip flop.
Got it. Okay.
So
But in both of them, you're actually mentioning the same emotion, which is minimizing.
minimizing.
Yeah. So now here's the thing. If you're repenting,
Yes.
that's how you start opening up that issue that you need to work through. It ends with forgiveness. There's something you need to forgive before you finish with it. You can't just repent a whole bunch of issues and then don't finish it off with the forgiveness end, because then it's not done. So
Right.
you are supposed to then forgive. But when those emotions were created, the damage was created in you, you were told to minimize it. It was done to you. So now you're discovering your own internal treatment of yourself.
Yeah.
Like when I said to myself, that's a burden. How much money is it going to take to treat you? How long is it you going to take? That's what was done to me. So now I have the same attitude to myself going, if you're this broken, how much is this going to cost me? And I knew as I said it going, oh no, I know where that came from. So when you start to say these things going, oh, that wasn't that important, it's not that big a deal, you're going, wait, I'm minimizing. How did that happen? Who did that to me? So then let yourself feel this feeling of, I feel my pain isn't as important as other people. That's how I feel. So I feel like I don't want to have to spend time on you because that really wasn't that big a deal. But experience it as an emotion, because then it brings up grief.
Yes, definitely. Yeah, it is grief for sure. Yeah.
Instead of going, oh, but that's not that important, that's you agreeing and living in it.
Yeah. Right. Yeah. Yeah. Okay. Thank you.
Absolutely. And every single suppressed emotion in our soul has to come out, no matter how trivial you think it is. If there's a suppressed emotion, it's causing heaps of pain everywhere. So, and to God, it matters. It matters that whatever you experience, it matters to God. Very, very much. So, God isn't minimizing you. You can. Please don't do that to yourself. Yeah. Kathy S., you had raised your hand, but you're good? You good? Okay. Other questions? Do you have any health areas that you want to talk about, or you want to ask about? What could it possibly be about? Some areas? I thought I'd be bombarded with questions. Kathy, yes?
I have, and a lot of women do have thyroid issues. Okay, so I have these nodules on my thyroid that I have been working on with alternate stuff for a long time. Yeah. I was trying to look up Louise Hay's book that connects, the issue, and it's a lot to do with self-worth. I think that's correct. Yeah, with the thyroid. What's your feeling about thyroid?
Thyroid is about, I'm basing it on some of Annette Nuntil's work. She wrote a different kind of book. And so thyroid is about you not being loyal to you, to your vision, to your calling. You are using your energy to meet somebody else's desire. Somebody else, you're not loyal to yourself. Thyroid seems to be about that. And skin, if I mentioned that last week, all skin issues, if you're having any kind of skin issues, you're denying rage or anger of some kind.
Yeah. Yeah.
So the anger that you know about is not the one causing the skin problem, it's something else. Sometimes we're like, oh yeah, I know I'm angry. I'm like, yeah, but you don't know about that particular anger because your skin's still acting up. I don't care if it's from eczema or if it's from hives or if it's from herpes or if it's from whatever it is, psoriasis. Psoriasis just means it's stubborn anger. You're a little more stubborn about the anger and about denying it than most people. And when I connected to my tiny spot of psoriasis, it was loathing. I had loathing, not just anger. It was deep hatred. And once I got into connecting into that, it started to heal very quickly.
Mm.
But it knocked the wind out of me. Like, wow, am I that angry? Whew. So if you judge anger, you're not going to let yourself feel it.
Okay.
Digestive issues tend to be denial of fear. And headaches, from what I've learned, is about not wanting to cry. I haven't sorted that out for myself yet. Selena.
I just wanted the name of that person.
Yeah, Annette Nontil. Noontil.
Oh,
Body is the barometer of the soul. Australian. It's an Australian book. I've lost my copy. Now, the body map, she's really good at that. But then she has like all these affirmations. Just do affirmations. Please ignore that part of the book. Just take the
yeah.
emotion aspect.
Yeah.
Other health stuff you guys got that you want some ideas on how to start breaking through it? Hardeep has asked about chest under the breast area. Hardeep, is that a skin issue, a muscle issue? What is it specifically? Because that will determine. And Bern, do you want to go ahead? We'll wait for Hardeep to chat.
Oh, sure. I think before, I meant to talk to you about arthritis in the fingers.
Perfect.
And now it's more in the wrists. It's creeping up into my thumbs, and then it's also in my toes. And sometimes it's like spasm and arthritis and pain in my toe. And I think you mentioned trauma, like terror, not trauma,
Yes.
terror.
Yeah.
Yeah. I wanted to forget it.
Yeah.
Can you say anything more about that?
Sure. So I'm working through autoimmune disease myself. And autoimmune diseases are generally about, I want to say, emotional incest with parents, where parents use children for their own emotions, which is a lot, but the child is not allowed to push back, not allowed to even say no, had to pretend to go along, that they're okay with it, that their will is taken. And so there's a sense of being invaded by somebody else's energy. And then your immune system is trying to push back at this enemy and attack it, but it's inside of you. So it's the denial of your anger at being violated and invaded. So when I started to work through my autoimmune condition recently, the first thing I came up with was this anger at, why are you in my skin? That was the first piece I had to kind of start to push out and how angry I am about it. I have a lot of kind of tight tendon pain. And I feel that that's denying the addiction of control, how much I want control. And then arthritis, I want to say there's some kind of self-hatred going on there. I want to say, yeah.
Oh, that makes sense. That makes sense, because I just smashed my finger open, like literally in a very, very heavy door, like split it open. And I feel that, just not caring. Yeah.
That's right. So there's some kind of...
There's often injury to my fingers or hands. Yeah.
Absolutely. I feel arthritis has some kind of anger and control going on. You want control, you're angry about not having control, or you're angry and therefore there's something there that you're denying that you have those feelings. And from what Jesus has mentioned, cancer is about immense anger denied very, very heavily about not getting your addiction met. Based on what area you have the cancer in, you can then tell, okay, your addiction is about this, and you're denying that you're angry about not getting something met. So there is that kind of stuff. That also happens. And then Hardeep is saying that she has skin. I knew it was skin. So Hardeep has skin issues in the chest area and also sore feet. So if you're denying sore feet, you don't want to feel how much, you don't want to admit that you feel very burdened by life. you don't want to work through that emotion, because then you're going to have to do something about it. You're going to have to say something or set some boundaries. That's the feeling that's coming to me right now. And skin in the chest area is you're denying how angry you are that this is what it means to be a woman, and all the expectation of a woman. Again, just the guesswork. But all you have to do is, like with the sore feet, you can just say, I'd rather have sore feet and suffer and limp than know what's really going on. I really, really, God, don't you dare tell me what this issue is about. I'm going to stay in this pain and I'm going to limp in pain all the time. You're not going to tell me what this is about. I do not want to know. Don't you dare tell me. Just get into that emotion. And very soon you're going to start saying stuff like that. Something else going to come out of your mouth. And then I also want to suggest that usually I've seen with my patients, whenever we work through some issues, like you come in with a health problem, we sort of figure out what the law of attraction is. By the time they realize what the issue is, they will also realize that the other events in their life were already pointing to it. So you already have other events in your life pointing to the same denied emotion as the health issue. So you can start working through any law of attraction event. And sometimes what I find is, if we start looking at the cost of the illness, if you start looking at, this is what the pain is like, this is how I'm suffering because of the pain, or because of the consequence of the pain, I can't have a relationship, I can't have jobs, I can't have freedom. Even if you start working through that as a law of attraction event, you can get into the same emotion. And the more you feel the pain of what it's like to suffer from your illness, the more you will grow your desire to say, I'm paying a very heavy price for this. Yes, I have a strong desire to not know what this is about, but I'm also paying a very heavy price. And I can really feel how much I'm really paying, how much I'm really losing from this. And that desire that grows will become bigger than your desire to not know. So it always helps to become fully aware of, I'm really struggling from this pain. Don't minimize it. Don't tough it out. Let it get big. Become all touchy and sensitive about it, because that grows your desire to know. Why on earth would I put myself through this much suffering just so I don't have to know something? Come on, seriously. So it grows your desire, and that's helpful. Kathy C, question?
Yeah, I'm just wondering about tinnitus.
Oh, okay. So tinnitus you can have low circulation in your blood, in your ear area. So there is lack of circulation. And if you think about it emotionally, you're frozen in fear. You don't want to move. So there's not much movement going on. There is also the bone issue. Mm-hmm. So again, I'm thinking fear connected to that, because there's a misalignment of the bone, of the sacral bones, craniosacral bones. And another one is people who are very, who channel, who can feel and hear the spirit guides, will get tinnitus. And I've had tinnitus for 15 years now, because there's very high audio signal coming to you all the time. And the discrepancy is too big. So I've had tinnitus for 15 years and it doesn't bother me. It's not that distressing, because I channel. Like I'm sensitive to guides, and I want to feel and hear messages. So that's another reason why you can get tinnitus. So,
thank you.
Casey.
Sorry, just a sec. I had to write it down so that I could be present to the other questions. So you mentioned a little while back that Jesus and Mary talked about cancer being anger of a specific area of origination.
Of not getting your addiction met.
Yeah. Would you say that most inflammatory issues in the body are also due to anger? Yeah. Okay.
We just think about how I really don't want to know how angry I am about whatever.
Whatever it is.
Don't want to know.
Okay.
Yeah. Selena?
Well, since this meeting has started, this has just been like stabbing right here, like kind of under the jaw, kind of where the jaw bends, like that round bit there.
Yeah.
Right there.
Okay.
Ooh.
Okay.
Inside, kind of. Yeah.
So jaw is about denying anger. That is, grinding your jaw. That is anger. And there's a stomach meridian going through there. There's small intestine meridian going through there.
Yeah, it feels more like nerve or gland or something. Like it's not the bone. It's soft tissue pain, not the bone. Yeah.
And it's on the right-hand side, so it's about a man.
Yeah. Yeah.
Yeah. Yeah, I don't want to know. And it's an attack. Because if there's a sharp pain, then I see it as an attack. I'm being attacked about something. So this is where I think about spirit involvement. Sharp pain, I always go, well, the spirit's involved now to attack you about what is it you don't want to feel about, to kind of enhance that area. They kind of help us to become more sensitive to that area. So could be that there's something you wish to say to a man that you're angry, that is about anger, but just go with, I don't want to know what the truth is in this issue. I really don't want to know. There's something here. I don't want to know. Don't tell me. I'd rather stay in pain. And then see what comes out of your mouth. Or if you're journaling, it'll come out of you as you write it down. Heather.
I know you're talking about your SCM earlier.
Mm-hmm.
What about the throat in general? I mean, you think of that as a different thing?
Yeah.
All right. And what's your take on throat?
Throat is about wanting to speak. And usually it's about stuff you're mad about, but you don't want to say it. Maybe because you judge the anger, or because you're afraid of the consequences that will come out of it. But if you look at anger as something that's an opportunity to go under it, that the anger in itself is not valid, whatever it is you're angry about, but it's just a way to get into whatever is really going on, then yeah, it could be that you want to hold on to your anger, and then so you deny that you have anger because you want to hold on to it. If you connect to your anger, you're going to have to deal with it. So truth is that I'm angry, but I want to hold on to it, and I don't want to say it.
That sounds about right.
Because of whatever the fears are, yeah. Yeah. I'm renewing my passion to let myself feel every tiny little pocket of anger I get. Like instead of going, oh, just angry, what are you denying? Go feel something else. It's like, no, go back into, I did that last summer. It was so productive. Like go back into every little hiss I get, just get into it. See what comes out. Just release that little steam, and it's, if you can not judge it. Yeah. So Harip's asking about receding bleeding gum. I want to say gums there's something about authority. There's something about being able to have your own authority, that you're feeling that you don't have authority. You're feeling that you're being stripped of authority, but you don't want to feel about those emotions. So it just eats away at you. Because teeth are your authority, according to Nantel. And I've kind of find that to be true. If you're not feeling you have authority, but then, or if you're too afraid to take authority because you want to maintain relationships, then you'll see teeth problem and gum problems. She also spoke about urgency, urination, that's fear. Or rather, some people would drink a lot of coffee and then have a lot of urgency. Well, you're drinking coffee because you're trying to get away from fear. So it's fear. You're avoiding fear. You don't want to process it. Other sleep issues tend to be, I love this. People who come in with sleep problem, oh my God, it's so hard to go, I need you to get this. People who don't want to sleep, can't sleep, won't stay asleep, are people who there's some kind of fear coming up and you really, really, really want to get away from it. You really don't want to know what it is. Because when you sleep, you start to drop into those emotional places. You may have dreams, you may feel them in your sleep state. So any kind of insomnia, I'm going, oh, you know, something's coming up and you really like, I will spend an hour literally wrestling with them. Just name the fear. I promise you, you'll sleep better. At some point they're going, oh, it's this fear. Once it's named, there's no sleeping because we can work it out. It's like you don't even want to know what it is. And that's when a lot of sleep problem happens every time. Heather?
Hey, I thought it might be important that everybody knew that Annette Noontill's book was recommended to us by Jesus.
Yeah.
So
right.
you were kind of maybe turning up your nose at Louise Hay's
Yes.
book, you know, when Kathy was bringing that up. And maybe that's because there's a better source.
Yes, exactly.
Yeah,
Yeah, I didn't find Louise Hay work that accurate. And yes, Jesus had recommended Hannah Nuntil book. I got the book and I found that it's really accurate. Yeah. Someday I'll write my own. I'll get there at some point. Bone stuff is always deep terror and fear. Cramps are always about avoiding terror. What else? Hot flashes in women is sexual shame. You're avoiding emotional sexual shame. That's what that is. And at some point, once you get comfortable with the feeling of shame, you can catch it very quickly. Allergies. Okay. Allergies. This few element. Allergies can show up in skin. So then you got the denied anger aspect. Allergies are about self-attack because it's your immune system attacking yourself. Your hypervigilance, you're seeing enemy everywhere. And Jesus say allergies are about avoiding grief. I haven't connected to that part yet because I haven't connected to my own grief in a big way yet. But those are some of the things that I found. And somebody asked, trash. Yeah, that is anger. Denied anger. Can't get away with it. It's okay to feel anger. Veins. Well, why are you asking, Hardeep, when the answer is always the same? So veins are about how blood returns back to the body. And fear, you're cold. Like you're cold, you're freezing, you're holding in, you're not warm, and your circulation are flowing everywhere freely. So veins also I find is fear, denial of fear, depending on which part of your body. Usually it's legs. And usually in your early age, stuff that's from very young age, you push it down to your feet and your toes. That's where it goes. So very, very young stuff goes down there and then it builds up. And somebody else asked, asthma is fear of feeling grief. So you can't even go into grief right away. You have to go into how terrified I am to feel grief, but I've completely cut off with why I'm even afraid. I don't even know what that feels like. And for myself, with the lung issues that I've had, I would get up 3 in the morning, 4 in the morning, gasping for air. That's part of the presentation. So I would get up in the morning and start to go, oh my God, I can't breathe, I can't breathe. And at some point, I started to let myself emotionally go through the I can't breathe and allow the panic attack to happen. So years and years of not being able to breathe, now I don't have that breathlessness as in I can't breathe. I let myself feel the fear. So now I get up 3 or 4 in the morning, not with not being able to breathe, but I just get up and go, I gotta feel some fear. So my body will go straight to just process fear. It just bypasses the experience of I can't breathe, gasping, because I already gone through that. It just goes straight into the emotions. So I'll spend a couple hours, middle of the night, letting myself feel some fears. And I do not have any breathing problems. And Hardeep has just asked if children having asthma, is mom not wanting to feel grief? Absolutely. Mom have now taught the child to also be afraid of grief. And in the child, the grief is also mom's. And the fear is also mom's. But there's also some ideas that asthma is about feeling suffocated by the parent. So there's also that. I've heard of that theory before. So that's something to feel about as well. And nosebleed is denying how angry you are. I think it's about being controlled. Nosebleed has an anger element. I had a friend who started having, actually, she was right in front of me. Yeah, it was a patient. She was having nosebleed. We started talking about something, and then she felt her nose running, and she go, "Oh my God, I'm not bleeding anymore. What just happened?" Her nosebleed stopped right there in the session. When she connected to what the emotion is, about how angry she is about something. The nosebleed stopped right there, and she's had it for weeks. It was kind of cool. Casey.
Hardeep actually touched on my question just briefly. All of the physical things that we're kind of talking about right now, when they show up in pets or children, it still are denied.
Yep. When they're 0 to 7, it's 100% yours, from what I've learned. But I do that with grown-up children, and every time it's mine. It's mine. It's terrifying, especially when all this depression and despair comes back to me, and I go, wow, this is what my kids been living with their whole lives. No wonder that explains all those years of depression they've had. Like, oh, okay. But it really, really helps. Even if you're 80 and your child is 60, you start working through something, your kid benefits. It's huge how much you can help them. So don't spend too much time feeling bad about what you've done. Be grateful that you can actually do something about it. Kathy S.
In terms of helping others, and I have a niece who's got a serious eating disorder.
Yeah, wow.
She's now 16. She's getting old enough to perhaps dive in a little bit. Do you have any suggestions and where and some kind of guidance? Because
yes, eating disorder is tough because it's a very, very, very strong addiction for control. Very strong. And the self-loathing is terrible.
Yeah.
The internalized self-loathing inherited from one of the parents.
Oh, I can see that. Yeah.
It's very difficult for them to see that their addiction for control is an addiction. Mm-hmm. They love that control. It's really tough too. But you know, I've talked to people who used to have these addictions and are now better. There are definitely a lot of people that have come through it. But you got to figure out why you have such a strong addiction for control, what that anger is about, and then be okay to feel the fear. And you can definitely get to it.
Mm-hmm.
Yeah.
Yeah, it's a difficult thing because I'm so far away, and
no, I was just going to say, Kathy, if you start to feel your emotions about what it's like that she's suffering, you'll start helping her.
Okay.
Yeah.
Because I do feel very connected with her spiritually, like I feel.
Absolutely.
Yeah. So, yeah, that's good.
As practitioners, if we can see like, oh, I got a patient with this issue, see it as a law of attraction event for me, and I start feeling my feelings about it, it'll start to help the patient. There's a lot. We'll talk about that in the practitioners section. But Kathy, you're feeling your grief about what it's like, that she's struggling, what it triggers for you, will really help her. You can do a lot.
It's triggering it already.
Yeah.
Thanks.
Absolutely. Just stay with how much you don't want to know what it is, how much you don't want to feel it. Just stay in the truth about those emotions. Agree with it because you're already doing it. You're just agreeing with what you're already doing. Get into the rant, get into the tantrum. You can drop through so quickly into what it is. It'll just come right out of your mouth. That, you know, when I said, I don't want to feel that I'm broken. And I'm like, broken? What is that about? Really? Did I just say that? Okay, let's go with it. And then next thing you know, this whole thing is opened up. I found my 14-year-old self. I'm feeling more whole already because I've got all these memories of my high school years back. The smells, the taste, the friends, what we talked about, what I used to feel, and the self-loathing and the self-hatred, all of those feelings are back. So I'm richer for having found that peace while also still feeling. And this part of me that I've just found is the one who has very strong will. So I'm already feeling like I feel more together, and I feel more, if I want to do something, I'm going to do something. It's going to happen. It's like, whew, boy, am I glad to have that back. So you start to find all these pieces come back. And I'm just going to stay honest with, I don't know how to work with it. Like I basically start saying, God, I don't know how to take care of her. I don't know what to do for her. I don't know how to heal this stuff. So I'm just going to keep going with, I don't want to feel this despair. I don't know. I don't know what it needs. It's too much. I feel insane. So you'll have, I feel insane. This will never end. I'm going to die. One of these three will come up. So you know you found the big one when you start saying stuff like that. And does it help if we talk about it with our kids? I find that in the beginning, parents are actually being pushy with their children. Don't talk about emotional stuff with your children. You're being pushy, you're being needy, you're actually kind of going, please don't feel bad, here's what I'm doing for you, this is what I was trying. You're actually really demanding on them. Don't talk about it with them unless they ask, because you're violating their free will. And they can already feel that, no, you're not doing the work yet. You're just saying stuff. I can feel what's coming from you. And so because when I first started doing this work, I wanted to tell them, look at what I'm doing for you. Look at what I'm feeling for you. Oh my God, look what I did for you. And then I asked, what are you looking for? I want them to tell me it was okay, Mom. It's okay, Mom. Like, ugh. I want them to reassure me, to get me off the hook. Like, ugh, that's disgusting. And so I do my work, and then sometimes I mention it, and then they're like, we don't want to know. Okay. And the cool thing is, when you're doing the work yourself and you see the results without you having said anything, your faith grows. You see, you're going, this stuff works. It works. So I suggest you don't talk about it. If they come to me and talk about, oh, I've been feeling about this and that, then I can say, well, yeah, you know how that got created in you? Here's what happened. That is helpful. It helps them connect to the emotion in your repentance. So parents, don't talk to your kids about this. My suggestion. Kathy C.
I notice when you talk about your 14-year-old self, you call her she.
Yes.
She's not you. Like,
because my trauma was so terrible that I have dissociated selves. I've actually dissociated. But by going through the massage treatment today, it's back. She is back. I can feel that person has integrated because I can feel all of her pain. I'm not looking at somebody, I'm actually experiencing it again. It's in me. But for some of us, you feel like that part of you is separated out, and you can see her, you can talk to her, you can engage her. Or sometimes it's nice to imagine you're doing that. I want to talk about how to heal the hurt self in a couple of months down the road.
Oh, okay, because I've kind of uncovered this part of myself that is like never, I feel like she has never even lived in this lifetime. That she's been I've been so repressed, she's been so repressed. So I'm playing with,
yeah, perfect.
Who am I? Am I her being repressed? And then I have this persona, or am I this persona and I'm so repressed it that I've never felt even who I am. So I'm just kind of like doing this, but I don't know if I want to call her she because it's actually me. So,
I do. I call, because it helps me to have a therapeutic relationship with that part of me. I get to be there. So usually we are the facade, and the hurt self is the real self.
Yeah.
That's the real person. And then we have all this addiction and facade to kind of, you know, I'm tough, I can do this, I'm strong, I'm not weak, is a facade self.
Yeah.
And then this hurt self is real, is more honest, is more visceral. And then once the hurt self is healed, then under it is your real self. So yes, you will find many parts of you that has not grown up, has not developed themselves. You will
I don't even feel, I can't even say grown up, even existed in a way.
Exactly.
Yeah.
That's how much our parents' emotional demands on us affects us.
Right. Okay.
That is what it's like.
Okay, thank you.
Yeah. Other questions? Brent?
Would you mind saying again, when you know that you've hit the real big issues, you said that you feel it comes up that you feel insane, or this will never end, or there was one other statement you made. What's the other one? I'm gonna die. Thank you. Okay.
How did you forget that one? You do feel that, like when I feel the breathlessness from the lung issues, and I'm feeling the panic of I can't breathe, it's like I'm going to die.
I'm gonna die. Yeah.
It's a fear. It's always the opposite. I probably sound more sane now than I ever have, but I feel insane from pain. Heather.
This question is on a bit of a different track.
Yeah.
But when you're working with a client who doesn't want to consider your premise that all of our physical pain is a result of our suppression of our emotions, what do you do with that?
Well, first I see it as a law of attraction event for me. So I look at it going, okay, she doesn't believe me. She doesn't want to hear me. She doesn't want to listen to me. She's rejecting me. Like, where does it take me? I'll go into that. And two, I'll usually just start with, usually with every condition, there's usually a suppressed emotion. And I'm kind of guessing if this is what's going on, it's probably this emotion. Just, I'm wondering, just guessing. And
you're
I'll stop.
taking that to them.
Yeah.
So you're kind of soft pedaling it.
So I'm just stop there. And then I'll let them decide if they want to continue. Some of them will go, oh, okay, sure, whatever. And they'll keep talking about something else. And I go, okay, that's good. I've said it because it is my practice to look at emotion. I will say, look, I can give you the supplements, I can give you the treatment, but usually until the emotion is released, you know, it doesn't really get better that quick. So I can give you something to help you along, but we're gonna have to go there. And at first I used to have a lot of resistance people. And then as I kept working through my emotions, now I don't have that at all. People can be brand new walking in and they connect to causal emotions within the session. It's incredible. It's so incredible to go, you've never heard of this before and you're already there. That took me 3 years.
But that says a lot about what you've done, you know, your own work.
Exactly.
Yeah.
Exactly. But yeah, it's okay to say, usually there's always some kind of suppressed emotion and I'm kind of wondering it could be this or that, if this is what you got. And then stop. And then wait for them to respond. Oh, well, I don't really believe in it. I want to be happy and joyous. All right, that's okay. Oh, cool. But you said it. And at some point, the penny drops because you've served, you've given the truth, and then you've respected their choice. Yeah. Okay. Other comments? We good? We got some steps to work through today? Yeah? Okay. So next week, we're going to talk about, Kathy's asking about wisdom tooth. Yeah, there's some wisdom tooth stuff going on in my house right now too. I haven't worked out what that's about, actually. Good point. Maybe I'll work it out. Because teeth are about authority. Wisdom tooth are always at the end. Maybe you don't feel you have authority by that age. You don't feel like you can own that part for yourself. You feel you feel incapable or low self-worth or something. Oh yeah, if it's about Isaac, well, you can see that, right? You can see he doesn't feel very confident at this point about stuff. So so next week I'm probably going to go into how to work through the issues once you know what the denied emotion is. So come with your blocks, come with your questions, come with here's what I try to do, and usually here's where I get stuck. How do you work through that? Come with your questions. I'll keep trying to work through what I discovered today so I can continue to have a fresh process to remind me how this works, document it, and then bring it to you next week. Any last words? We good?